works, Daisy.
You sure?
I'm going to hang up, okay?
Okay.
Hello, everyone. Good afternoon. It's Dr. Numani here. Sorry for the late start. We had some technical issues, so if there's anyone here, please put your name in the chat to just say hello so we're sure it's working. Shout out for the first live stream ever. So if you're here, just say hello in the chat. Okay, looks like we have someone in here. So I just need to know that it's working.
Yeah, someone in here. So I just need to know that it's working. Yeah, someone in here. So I just need to know that it's working.
Okay, I think we have two people here. Hello, hello. So if you're here, just say hello. Okay. Awesome. Hello, everybody. We're just going to say a quick hello. Thank you for being here today. So just put your hellos in the chat, just so we know it's working. And if it's your first time here, welcome. I'm Dr. Amaka Namani. Thank you for being here. We'll just wait a couple more seconds to see if anybody else is going to join us today. I'm sure there'll be lots of us, and if not, we'll just have a nice, merry conversation. Yep, I think we have a few people here. Okay, very good. Let's see. Okay, very good. Awesome. So let's officially or unofficially get started. Again, I apologize for a little bit of a late start here. We did have some technical issues. But I'm grateful to be here with all of you guys. And next time, I promise there will be no technical issues. Well, as best as I can promise. So welcome again. I'd like to start by introducing myself. My name is Dr. Amaka Numani. I am a board certified general pediatrician for well over a decade. I am also a wife, a mother of 3 beautiful children, ages 14, 12, and 6. I am an author of a best-selling picture book on breastfeeding, which is called Zira's Quest, Mommy's Milk Rocks. Additionally, I mean, obviously with my book, I have a lot of passion around breastfeeding. So a lot of my work centers not just around child health, but really around breastfeeding awareness, education, as well as just postpartum health, especially as it relates to the 4th trimester. I'd like to want to make sure and just put some disclaimers here. So this is obviously a live, so that means that we cannot control everything that's happening. So please be kind. If you're going to put questions, just please put them in the chat. If you have not subscribed, this is your time to subscribe, like, and turn your notifications on so you know when I post a video. We do one every week. On the Dr. Amaka Namani channel. And we are all about preparation over perfection. Please note that this is general medical education. So none of the things that I say today should be considered personal medical advice. If there is an emergency with your child, please go to the closest emergency room or talk to your pediatrician. Do not put specific questions about your child. Do not put your child's identifiers. So don't say Johnny is 2 years old and today. You can say, what happens if I have a 2-year-old with constipation? What can I do? You can ask questions like that, but please do not put patient identifiers. I am currently licensed in the state of Pennsylvania. So that is where I am legally and currently licensed to give medical advice. If you are one of my patients, please send a message, use your portal, or call the office, and we'll be sure to answer that. Okay, so we're going to jump straight in. So I really want to start by sharing a little bit of my why, right? So as a pediatrician who owns her own private practice, I realized that a lot of a lot of my moms were getting their information on, Dr. Google or Dr. TikTok and all of that stuff. And so I decided that I was going to, be a trusted resource for making sure that moms get their questions properly answered and evidence-based, with evidence-based answers, considering what's going on in the world today. So this was really my why for having this channel. We post a video every day, every week. And we are really, like I said, our tagline here is preparation over perfection. So I am going, if you see me looking down, that's because my team's going to be letting me, kind of be giving me updates as to any questions that you may have. So I am going to be looking down just for that reason. Okay, so let's get right into it. Let's see if there are any questions here already. If before you put questions, if you don't mind, just kind of putting your information in the chat where you're joining us from. Any questions you may have, if you're a new subscriber, old subscriber, and just anything about yourself you think you want to share. Okay. And while we wait on that, I will just probably go ahead and just talk about some general things about pediatrics before before we go ahead and look for those comments. Okay, so a few things. Obviously, as a pediatrician, we take care of children from the newborn stage to till they turn 18, and really hypothetically we can see we can see them up until age 21. But in my practice, when you turn 18, you start having adult problems. So I kind of say, okay, it's time to go. Okay. So, because I have to have a pediatrician, you don't have to, but I strongly recommend that you do, just so that a pediatrician is trained to have those specific answers with relation to as it concerns your child. So if you look at my channel, we've done prior videos around newborns, right? So if you're a mom who's pregnant here, this is where you want to be, because I've done videos around when you're pregnant up until when your baby, and currently going through the different stages of life. Right. So a lot of new moms, I have the new mom in mind when I have a lot of these questions that are asked. So some of the things that I get asked are, how do I know what I should put in my what do you call it, my baby registry, right? And a lot of us have walked that path, so learn from the rest of us who've put all the fancy things that they never used, right? So I always say the most important thing that your child needs is to know that they're loved, right? Your child needs a safe place to sleep, good food to eat. When I say good food, really in the first 6 months, all they need is your milk as mom, and or formula if you choose not to breastfeed. If you know anything about me, you know that I strongly recommend and am an advocate for breastfeeding. So that's really, really what I would recommend. It's the best milk for your baby. Babies do not need any other liquids besides breast milk and formula in the first 6 months of life. So, those are the most important things your child needs. So if you're always wondering, if you're wondering what should I have in my child's registry? Important things I usually say, you pack and play. Right, your child doesn't need a super fancy crib. If you're super fancy and want to have a nice, big, beautiful, expensive crib, please go for it. But just know that that is not a necessity. So that's one thing I always like to share. I actually do recommend childbirth classes. If you are able to, you're in an area where you're able to have one, go ahead and do those. Go ahead and do those childbirth classes, so because it gets you kind of familiar with what to expect with the birthing process. Truly, as a veteran who's done this 3 times, I don't know that anything truly prepares you for life as a mom or to birth, but I think the more familiar you are with the general processes, allowing yourself to be flexible, the better. Okay, so you usually want to do that. And one thing, if you know again anything about me, you'll know that I always say books, books, books. So those early years are so important. Make sure that you have books in your registry, And this is one that a lot of moms don't think about, which is services, right? So instead of putting the fancy clothes and the fancy machines that you probably will never use, have people sign up um, to have services. So people who will help you with laundry, with cooking, with just with household chores, especially if you have other children. Those are things that I certainly recommend that you consider as you know before your first child is born. And then when the child is born, you know you really definitely want to see your pediatrician within the first 3 to 5 days, ideally within the first 3 days, because a lot of babies are losing weight. So you want to make sure that your baby isn't losing too much weight that we need to keep an eye on. Um, so I'm going to just check in here with the team and make sure that we don't have any comments yet or any questions. Um, and then we'll move ahead. Right. So yeah, so just make sure that you are, you know, obviously taking care of yourself. In the state of Pennsylvania, doulas are now officially reimbursed and paid for. So you don't necessarily have to have the funds. If you have a Medicaid product or a state insurance, you should actually be able to qualify for having a doula. There are kind of nuances around it, but those are things that you definitely, I would strongly recommend that you consider if you don't already have one. Okay. So again, if you're just joining us, welcome to the Dr. Amaka Namani Show, where we're all about preparation over perfection. If you have not subscribed, please subscribe. So that you know when we drop a video. Just say a hello in the chat so we're sure that you know you are, you know, we get all your questions answered. I said earlier, if you see me looking down, it's because I'm just making sure certain with my team here that we don't have any questions in the chat. Okay. And so we had some kind of prep questions that we wanted to ask I wanted to make sure that we addressed some of them around just general information with regards to infant care, so constipation, reflux. Those are some very important questions that I ask. Feeding, um, questions around how should I take care of my newborn's nails, right? Like should I file, should I clip the nails? So I'm just going to just address some of those quick ones while we keep an eye out for further questions. Okay. Um, all right. So I'm going to look down here and make sure we don't have any questions. Okay. All right. Very good. So I'm going to start off by answering one of the simpler ones here, which is around clipping your, like how to take care of your newborn's nails, right? So one, I say do what you're comfortable with, right? So that's usually for a lot of people filing down, right? I was generally comfortable with filing or trimming my child's nails, but that's something that you can choose how you want to go about that, right? So you can file your child's nails or clip them. I find a lot of moms feel a lot more comfortable with filing. So that's something that I would generally recommend, right? Children's nails grow really, really fast, like newborns especially. So you want to make sure you're doing it at least once a week. Do not bite your child's nails, please. You're giving them your you know your bacteria from your mouth, and then they put it in their mouth. We don't need that. So biting your child's nails is not something that I'd recommend. I do recommend that you either file or use a nail clipper. Okay. um, all right, so let's see other questions here. Okay, so around constipation. So constipation can be a loaded question, whether depending on the age of the child. So whether it's a child that is a newborn, an infant, or a an older child, right? And the question is like, really, what is constipation, right? And FYI, I actually have done a video around constipation here. So newborns can go up to 5 days at a time without having um, a a bowel movement, and actually that is normal. So that's all within normal range. If a newborn goes up to 5 days without having a bowel movement, so nothing for you to panic, especially if you've had like if you've had changes around your child's like feeding patterns. So if you have a child who was breastfed and now is formula fed, you will see those transitions. If your child has not had a bowel movement for more than 5 days at a time, it's a good time to check in with your pediatrician and make sure that they're seen. Importantly, one of the first questions I ask my moms, especially for moms in the for infants in the newborn period, is making sure that your child had a bowel movement in their first 48 hours of life, right? So here in the US, a lot of hospitals will probably not discharge you if you did not have a bowel movement prior to discharge. So that's something that you definitely want to be making sure of. And so if your child has gone more than 5 days without a bowel movement, we definitely want to check that out, and your pediatrician will make some interventions to make sure that that works. And now for older children, we generally again, you want to know what's normal for your child. Like, what are your child's normal patterns around when they have bowel movements, so that when they don't, you know what's abnormal. Again, in one of my videos on constipation, I talk about how you can actually have a bowel regimen. So it's really important to make sure that your child is eating, and you really, most of us should be eating high fiber food. So making sure you're drinking a lot of water and eating high fiber food. So high fiber foods include your vegetables, green or not, like all your colorful vegetables, fruits, drinking a lot of water, because there's a term that goes garbage in, garbage out. So your poop really is a reflection of what you're eating. So if your child is not having regular bowel movements, you definitely want to make sure that you are giving them high fiber foods, right? And then you can actually have them, I usually say pick a time of day that works for you. For a lot of parents, that's usually the evenings. So having them sit on a potty for about 5 minutes, and then having them have a bowel movement. I mean, just having them sit, they can read a book. They may or may not have a bowel movement the first few days, but after that, a lot of children begin to actually have bowel movements around the same time. So it is predictable. You can actually almost predict how frequently your child will have a bowel movement, and that is all. That's typically how we usually want to have it, is where your child has regular bowel movements that are soft and or pasty, right? If you have hard tarred stools or turd like hard stools, that's usually not a good sign. So that's one of the things you definitely want to know for constipation. Okay. Um, so we're going to check here and make sure. I think we have a few people here. So just make sure that if you have any questions, please put them in the chat. And we'll be sure to get those questions answered. But in the meanwhile, I'll answer some of the questions that were sent prior. So some of the questions that, if you're just joining us, welcome to the Dr. Amaka Namani Show, where we emphasize preparation over perfection. So you will never be a perfect parent. So be okay with that. But you are the perfect mom or the perfect dad for your child. Okay. So everything that I do around educating you is just to kind of prepare you for the best we can for what you may or may not know. So just be okay with the fact that you will never be that perfect parent, but you are the perfect child for your parents. Okay. So we've answered some questions around newborn feeding, breastfeeding, questions around constipation. I'm actually working on a series around breastfeeding. So we'll be sure to make sure that if you have any specific questions around that, be sure to put that in the comment section. And if you have not subscribed to our channel, this is a good time for you to do that, so that turn your notifications on, so that when you have any questions, when we have any videos, you know when we have those. Okay, so we're going to just do a quick check-in here to make sure we don't have any live questions. And if not, I'll move ahead with some of the pre-submitted questions here. Okay, and if you're joining us from anywhere outside of the US, please put your information in the chat so we can say a quick hello to you. Okay. And welcome again if this is your first time here. Very good. So let's answer some questions around just some of the popular topics I get really around rashes, right? So eczema I'll start off with. I've done a video on this, but I think that one is worth doing because it's a very common skin condition that I get a lot of questions around. So eczema really is kind of it is a skin condition where your child may have or has sensitivity to certain products, and then as a result they get like what we call dry scaly patches, right? And a lot of times, and depending on the age of your child, it will be probably in different parts of their skin. So in infants and younger children, we see them more in the flexural areas, we call it. So flexural areas is usually right around, the elbows, the arms right here, the elbows, behind the knees. That's some of the most common places that we see it. The trunk, which is kind of like the chest area. And again, depending on, the child's skin color, eczema can look different. So for children who have eczema, a few things I usually recommend are making sure you have a very good skin regimen, right? So a good skin regimen involves using fragrance-free products. So you want to make sure that you are using products that don't have scents, right? So while products that have scents really smell good and nice and fresh, um, they don't are not children who have eczema tend to have a lot of sensitivity to it. Okay, so you usually want to make sure that you have your child using fragrance free products. So from the laundry detergent, so making sure you're not using hard or strong fragrances or scents. You don't want to use dryer sheets. I've had parents who ask, "Can I use like a cotton ball or something?" If that's fine, as long as it doesn't have any fragrances in it. Then you also want to make sure that, excuse me, that you are using, products under skin that don't have fragrance on it. So whether a lot of people like the CeraVe products, the La Roche-Posay products, those are all great products to use on your skin. Anything really that doesn't have any harsh or strong scents here are all good to use. Okay. And I typically don't recommend using soaps because soaps can be drying for your skin. So making sure that you are using washes a lot of times, and then using things that are thick. Like I usually say, use things that are in a jar versus things that you can pump out of. So things that say lotion on it will typically not work for the skin of your child if they are, because lotions are water based. You want to use things that are oil based and not water based. Okay. Very good. So and then you really want to moisturize several times throughout the day, making sure that you are not making sure that you are not using again those harsh scented products. Another question I usually have questions around is allergies, right? It's summertime. A lot of children are having allergies, and I get questions around, how can I manage my child's allergies? So let's start by talking about just kind of how allergies happen, right? So typically the way the immune system works, children less than 2 years of age typically will not have allergies to exterior or environmental triggers. So a lot of children who may under age 2 who may have reactions will usually be children who have indoor allergies. So they may have allergies to dust mites, or they may have allergies to pet dander. Those are all things that they can have allergies to. But the way the immune system works, their bodies need to have seen like probably 2 seasons of environmental allergies or pollen in order to mount an immune response. So that's really important to have. So I have moms, who come in and say, "Oh, my 2-month-old has, I think they're reacting to the pollen." That's usually not the case because a 2-month old can usually not mount an immune response, right, to an environmental factor. So that's again really important to remember. And then for other children who have, like what we call allergic rhinitis, which is a fancy name for having, nasal drainage or, coughing, or, what we a lot of times will have what we call the allergic salute, which I actually had a lot. So that's because they're doing a lot of this, right? And so because of that, they have a crease on their nose. So we call it the allergic salute. And then you might find that the eyes of your child are boggy or almost like black circles sometimes around the eyes. They might be itching a lot, clearing their throat a lot, coughing a lot at night. Those are all signs that your child may have an allergy to something, right? And so obviously seeing your pediatrician for that is important. And some things to do. I also believe in natural, like nature. So one of the first things I'll recommend is honey, especially not store brand honey, but actually locally sourced honey. So if you have like a local person in your area who sells honey, getting that local pollen into the system actually does help. And then I will usually start them, like my patients on like antihistamines. So like not a drowsy one, something like a Zyrtec or a Claritin. Now, depending on the age of your child, we may start from as low as 2.5 mLs to higher depending on the age of your child, right? So a lot of them here are marketed for 24 hours, but there are children who may need it more than once a day, right? So those are just some important things to really know around allergies. Just making sure that just making sure that you are just looking out for those signs. So some of the signs of allergies again are watery eyes, just always sniffing, the allergic salute, they're always doing that, clearing their throats. So making those sounds. Again, like I said, watery eyes, and some children may actually have their ears itch because your ears, your nose, and your throat are connected. So those are some things to watch out for with regards to allergies. And again, starting with like a locally sourced honey or an over the counter, usually over the counter antihistamine like a Zyrtec or Claritin, a lot, or like a Claritin, yeah, will usually a lot of times clear a lot of those symptoms, right? And so with that, I'll go into the next question here around asthma, right? So this is a very, very common one. Now, asthma is a pretty loaded subject, so we're not going to be able to do a deep dive into it. Um, into those. So I'll just do a general talk on asthma and its management. And if there are any specific questions around asthma, please leave it in the section, in the comment section. So, asthma basically is a respiratory condition. So it's a lung condition in children, and you can see it really in children as young as 2 years of age and older. A lot of children who have asthma have different triggers. So some important triggers around asthma are environmental allergies, like we just talked about. So pollen, environmental pollution. Some children have exercise-induced asthma, and several other causes, right? So we as pediatricians and physicians really do a tiered classification with regards to asthma. So you can have mild intermittent asthma, moderate asthma, persistent asthma, nothing you have to worry about as a mom or a dad. But we usually ask you specific questions around the control of your child's symptoms, or basically how frequently they have those symptoms. So are they coughing more than twice or three times a week? What are they doing? What are those triggers? We ask very specific questions to help us diagnose what kind of asthma and or if your child has asthma. And a lot of physicians will also do what we call a pulmonary function test to check the status of your child's lungs and make sure that your child, to just basically check if it really is asthma. A lot of children who have asthma have symptoms that are worse in the evenings or at nighttime. So that's one thing to know. And a lot of those symptoms are usually around coughing, right? So you might have a lot of children who cough more at nighttime, and that's usually something that we definitely want to, keep an eye out for. And so, depending on the kind of asthma your child has, several times we'll usually start off with albuterol, which is really a control, what we call, it helps with an acute exacerbation, we call it. So just making sure that your child's lungs are conditioned, and it gives your child immediate relief, right? So it's important to note that your child needs to use an inhaler, an inhaler, not your child does not have to use an inhaler. I retract that. I typically recommend an inhaler, but what I was trying to say is if your child has an inhaler, you usually want to use a spacer because that's what makes sure that everything gets into your child's lungs and that it's not kind of diffusing out in thin air, right? And depending on how severe your child's asthma is, we may also recommend that your child see a pulmonologist who is a lung specialist for your child. And even before doing that, a lot of us as primary care physicians will start your child on a controller medicine, which is a steroid. Um, and really, with new guidelines, there are actually several inhalers that have both a steroid, which helps condition your child's lungs, but also albuterol, which also helps to give instant relief to your child. So that's usually, there are a lot of those combo inhalers that are coming up now. So if you have specific questions around your child's asthma, feel free to put that in the chat, and or make sure that you're following up with your pediatrician and you're under your physician. In my practice, and actually this is usually what we recommend, a lot of a lot of pediatricians definitely want to see their patients who have anything more than a mild asthma at least every 3 months to make sure that things are going as planned and that it is it's properly controlled, right? So usually most of us will give you what we call an asthma action plan, and an asthma action plan is basically what to allows us to see how well your child's kind of gives you a plan for how you know that your child's asthma is well controlled. So you want to make sure that your child is, we don't want to have your child having, coughing a lot during the night or during the day. So a lot of those symptoms, we tell you what to do. You have the green zone, the yellow zone, the red zone, and basically what to do in each zone. The green zone is usually where you want to be around with control of your child's asthma. Okay, very good. Um, so let's see here. Um, so uh, if we don't have any live questions right now, we'll be sure to, make sure to put your questions here in the chat. I'll probably do one more topic here. We're getting close to the hour here, and then we'll round it up. So be sure to if you are watching a replay, put replay in the comments. If you found any of this information helpful, remember to subscribe and like and follow us so you know when we post a video up. Um, and so to be sure to follow us on Facebook, on YouTube, and if you are in the state of Pennsylvania and or in Northwest Pennsylvania, be sure to follow us on our Facebook channel, which is Franklin Pediatric Associates. Okay, very good. So we've talked a lot. We've talked a little bit here about allergies. We've talked about asthma. We've talked about constipation. We've talked about just general things around breastfeeding. And I'm currently doing a series on breastfeeding. So if you have any questions around any of those, be sure to put that. And otherwise, if you are watching this, like I said, if it's a replay, just put replay in the chat. We will continue to look at your questions throughout. So if you have any questions, if you feel like you missed us live, please be sure to put your comments in the chats, okay? And we'll be sure to make sure that those get addressed. And actually, that may be the reason that we do a new YouTube video here for you. Okay, so I want to make sure we kind of hit most of the systems here, right? So we've talked about allergy, which is its own system. We've talked about a respiratory, which is asthma. We've talked about the skin, which is eczema. We've talked about nutrition briefly here around breastfeeding and formula feeding, and we'll continue to follow us for those for videos around breastfeeding and or for the series. We'll do something around the ears, right? So let's talk about ear infections really briefly here. So ear infections are one of the most common infections in children, especially in children 6 months and below. One fun fact you should know actually is that breastfeeding tends to be a protective factor for children around ear infections. Now, for most, it's important for me, I usually like to share this. If you are a mom or a dad that smokes, you actually are increasing the chances of your child having an ear infection. So that's something, if that's not a good enough reason for you to quit, knowing that may be, okay? All right. So, and actually, most ear infections will spontaneously resolve. So, in my kiddos who are, especially if they're over 6 months old, breastfeeding and are not exposed to smoke at home, I usually do a watch and wait. And a lot of times we find that ear infections can be overdiagnosed. So an ear infection, we usually have to use an otoscope, which is a fancy instrument that we use to look in your child's ears and your child's middle ears, right, to find out if they have an ear infection or not. And a lot of people will think, oh, my child's ears looks red, or they even go to the urgent care. And if it's not someone who's versed, like a pediatrician or another physician, they may overdiagnose your child. So having red ears does not mean that your child has an ear infection. Your child needs to have not just red ears, but also inflamed ears, right? So bulging, right? I'm sorry, not inflamed, but bulging. We look at the tympanic membrane, fancy name for your child's middle ear. And then, depending on the age of your child and the child's risk factors, a lot of us may decide to do a 48-hour watchful wait or start your child on antibiotics. And the first line of treatment usually is amoxicillin. Okay. And if your child is allergic to amoxicillin, please talk to your pediatrician or physician around other choices for your treatment of your child's ear infection. Okay, so that's something really I really want to share. And now, this time of the year in the U.S., it's summer. Um, so that means that I'm seeing a lot of cases of what we call the swimmer's ear. So swimmer's ear is very different from what we would call, what most people would call an ear infection, right? So swimmer's ear is an infection of your outer ear. And typically how we diagnose that a lot of times is if you peel your child's, what we call your child's tragus, or push this in, there's a lot of tenderness or flinching. And usually the treatment for that is using eardrops. And with that, we usually want to make sure that your child is not swimming for the duration of treatment, which is around 7 days. And if your child is taking showers, we typically recommend that you use earplugs. So if your child has an outer ear infection from swimming a lot, which affects the pH of your child's ears, that's usually the kind of like what sets your child up for that outer ear infection, then we usually want to use eardrops for at least 7 days, and it has to be the right one. And so a lot of times here, it's ofloxacin that I'll use for a lot of my patients. Okay. So we've done the ears. We've done allergy, we've done skin, we've done nutrition. What else have we done? And we'll do one more. And then if we have any questions, we'll put that in the chat. And if not, we will wrap this live up, and we'll plan for the next one. Okay, so we'll do something around we'll do maybe a thing around the nose, right? So this was a good one because I just recently saw a kiddo in my office who had a foreign body in their nose, right? So if you have a toddler, that is a risk factor because toddlers will put everything everywhere. So obviously you always want to make sure that your house is child proof. So I start having the child proof talk in my office usually as early as 4 to 5 months. Once your child is mobile, and really mobile means your child is, once they can roll over from their back to their tummy or tummy to their back, starting usually around 4 months of age, they're mobile, right? And so when they start crawling, walking, that gives them access to a lot of places and things. So the most important thing is to prevent it, right? You don't want to have things accessible that you don't want your child in. So if there's something you don't want your child in, just put it out of reach and out of sight. But if for some reason your child has something, you may not even know your child has put something in their nose, right? So in this case, this mom actually didn't know. And one of it's a foreign body in the nose a lot of times actually will be associated with what we call halitosis, which is a very fun fancy name for bad breath. So if you have a toddler and you're like, oh man, I think their breath stinks more than it normally does, like early in the morning, that may be something you want to check out, right? And so a lot of things that they'll put up their nose, of their nostrils, are things like little toys, like I've seen little marbles or beads, right? That's a very big one, right? And so we usually have to use an instrument. And sometimes your primary care physician may not even have the right instrument. That may be an emergency room visit. Do not try to do it at home. I've had moms who try to do, suck it up. It is a technique that works, but you definitely want to make sure that you know how to do that properly. Okay. And so with that said, we'll just make sure that there are no pressing questions here before we round this up. And next time, if you have any questions, even if you're watching this in a replay, it's okay if you didn't catch us live. Just be sure to put your questions in the chat so we're sure that that we get to all of them. So I'm going to check with my team here, make sure we don't have any questions. And then if this is your first time here, again, welcome. If you're just joining us, please put your information in the chat or comment section. Say hello. If you're watching a replay, say replay in the chat. Um, and we'll be sure to say hello to you. Looks like we had a couple more people join, so please say hello. We are just getting ready to round it up here, so if you have any questions before we end the live stream, be sure to put that in. I'll just wait a couple minutes here. And while we do that, I'll just share a few more things on how to get in touch with me. So you have a YouTube channel here. I'm on Facebook, the Franklin Pediatric Associates. If you're in Pennsylvania, Northwest Pennsylvania, looking for a new pediatrician, we are open to new patients 11 years and under. I'm also on LinkedIn as Dr. Amaka Namani. And also on Amazon, I am the author of the best-selling book, Zira's Quest, Mommy's Milk Rocks. Whether or not you're breastfeeding, this is a really good book to have as a resource for your children and for yourself, to learn some fun facts and just to learn some new things that you may not have known about breastfeeding. So if you were here, you joined us the entire time, thank you for joining us. Follow us and subscribe, and make sure that you join us for notifications. And until then, remember, you are the perfect parent for your child. On the Dr. Amaka Namani channel or show, we are all about preparation over perfection. So until the next one, thank you for joining us, and I will see you soon. Bye.